everybody, and to those of you online, good morning, good afternoon, good evening, wherever you are in the world. And thank you all so much for coming and joining us. We're very excited about this event today during our Health Week. My name is Ellen Roskam, and I am the coordinator of the International Geneva Global Health Platform. It's our 10-year birthday this year. And we are very happy to host this event today on One Health and Pandemic Prevention in Practice is the Global South Leading Innovation, which is a very kind of unknown, unrevealed issue. So we're privileged today to have with us experts in wildlife surveillance, governance, and prevention of zoonotic spillover. And our esteemed guests will be discussing innovations in implementing the One Health approach in China, Côte d'Ivoire, the Democratic Republic of Congo, and the Philippines, and possibly an additional 3 countries if there's time. And the lessons for pandemic preparedness, prevention, and response. The recording of this event will be available in 1 to 2 days, and you can access it at ghplatform.org, our website. There will be a couple of Q&A sessions, so we hope you'll be really active and engaged. For those of you online, please also join into the Q&A as if you are here physically, and use the chat box. And our moderator will be following that and taking your questions. If you have a question for an individual speaker, you can also submit that right with their name. And I'm delighted to introduce our moderator today, Nina Jamal, the International Head on Pandemics and Campaign Strategies at Four Paws International. Nina, thank you for joining us, and the floor is yours.
Thank you, Ellen, and greetings to our guests. I'm honored to moderate this session today because we will gather inspiration and reality checks from experts on pandemic prevention and One Health in practice. And after the pandemic started, when Four Paws began working on pandemic prevention advocacy, we were sending emails to the diplomats in Geneva, and their first reaction was, how cute. Four Paws is sending us policy briefs. And then that was a good entry point for us to actually get those meetings. And then their first question was, what is an animal welfare organization doing in a global health debate? And we explained, we said, given 75% of emerging infectious diseases in humans have animal origin, we can't prevent pandemics without changing what we're doing to animals. And the problems we're trying to solve for animals, so closing fur farms, tackling factory farming, wildlife trade, those problems, solving those problems will prevent zoonotic spillover. So in short, we are in the health debate because the health and well-being of humans, animals, and the environment are interconnected. And One Health is the best approach to solve complex health problems like pandemics. So we need to operationalize One Health for the sake of humans, animals, and the environment. And as some of you may have heard, One Health has been described as contentious in the context of the pandemic agreement negotiations. And the perception is that One Health is a set of onerous obligations imposed by high-income countries on low and middle-income countries. But is One Health really a global north agenda? And is all the knowledge and expertise on One Health in the global north? Well, you can be the judge of that, because today we will have a sneak peek into One Health efforts in a number of developing countries, detailing how One Health policies are being implemented to prevent zoonotic spillover and bolster pandemic prevention. And now I'll briefly introduce our speakers before handing over to them. Our esteemed experts today are Arlette Inde, who is a research associate at the Swiss Center for Scientific Research in Côte d'Ivoire. And she will talk about trends, gaps, and perspectives on One Health for wildlife surveillance in Côte d'Ivoire. Our second expert is Chloe Clifford Asbury, and she's a postdoctoral researcher at the York University School of Global Health, and she will talk about One Health innovation taking place in China, the Democratic Republic of Congo, and the Philippines, followed by Benjamin Roche, the research director at the French National Institute for Sustainable Development and co-founder of PREZOD, which stands for Preventing Zoonotic Disease Emergence. And he'll share examples of the work of members of PREZOD. And we will first hear from our speakers, and then we'll have a first round of questions after having conversation, and followed by a conversation with our speakers. So Arlette, I'll start with you. I have a small question. Your research focused on the challenges tied to wildlife surveillance in Côte d'Ivoire, and you looked into 10 years worth of research, including 600 papers, and conducted interviews with relevant institutions responsible for health surveillance. This is an impressive amount of work. What did you find out?
Thank you. With the regard of the epidemics and pandemics, the health crisis that we faced, the idea of the study was to look at different perspectives, from the perspective of government and also research about how they deal the wildlife sector in the public health. And we observe the result that we had showed from the research perspective, there is, from the last 10 years, an increasing of the research on wildlife. But this research is still intersectoral, more focused on biodiversity and conservation, with very poor linkage between the different sectors. And also the health aspects and also food security aspect related to wildlife are less addressed. We had only 5% of the paper dealing health which addressed aspect of wildlife disease surveillance. And from the side of the government, we had different surveillance plans from public sector, human sector, and from animal sectors. But these plans do not integrate wildlife sector in that surveillance plan. We also observe a lack of collaboration between the different sectors in the government. But we have a great opportunity to have a national One Health platform which should coordinate all health action between the different sectors. And this platform is an opportunity to push really the wildlife sector in the public health system. So thank you.
This was incredibly concise and to the point. Thank you so much. So basically, there has been a gap in research, and you've identified that public health is not tightly linked to wildlife surveillance yet. So this proves actually the importance of expert research. You identify the gap, and having the One Health platform would be an opportunity for them to integrate.
Exactly. And the One Health platform should coordinate the different action. And the chance that we have is the One Health platform is hosted at the Prime Ministry. So we have policy in that platform. And until now, each sector, animal, environment, and also human sector work at its, yes, in silos, yes. So the idea is if we have a health issue, we need to come together and find the solution together and also for the action, think together and then act together from the One Health platform. Yes.
Thank you so much. So joint strategies under the One Health platform would be the most effective way. Thank you so much, Arlette. And I'll move on to Chloe next, and I'll give you the microphone. Oh, you have, that's good. So Chloe, you explored One Health innovations and their intended impacts in China, the Democratic Republic of Congo, and the Philippines. Can you tell us more about your work and the innovative One Health implementation examples? Also, since you looked at 3 examples, did you find any differences or patterns of similarity across the studies that you analyzed?
Yeah, absolutely. So I could give a little bit of background briefly on how we can kind of take this kind of comparative perspective, is that we did this project as part of really a super collaborative team where we worked with institutions in each of the 3 kind of countries that were cases within the project. So we had colleagues at UP Manila, at the University of Kinshasa, and at the Zhongnan University of Economics and Law, so kind of doing in-depth work in each of those countries and kind of allowing us to exactly look at kind of some patterns and differences and similarities and lessons that could be drawn across those contexts. So the kind of project aimed to really understand how wildlife policy and governance intersects with pandemic prevention and the risk of spillover. And it was interesting, Arlette, what you were saying around how so much wildlife-focused research is really around conservation and biodiversity, because I think there's something similar to be said about policy. A lot of the policy efforts have focused on those kinds of agendas, and there's been less concern or emphasis on what the outcomes are in terms of zoonotic disease and spillover risk. So as part of this project, again in collaboration, we ended up interviewing over 100 participants across those 3 case study countries. And we were aiming to look at kind of lots of different perspectives. So we spoke with policymakers, folks in research, civil society, as well as those more at the kind of animal-human interface. So there were interviews, for example, with market vendors, slaughterhouse workers, like farmers, people working in different contexts, as well as the general population, to understand when these policies get implemented, what might happen on the ground kind of thing, and how are they impacting different actors and different outcomes. So we want to get those different stakeholders' perspectives and kind of tying in with, I think, Arlette's work too, that we were looking at zoonotic spillover risks and those kinds of outcomes, but also food security and livelihoods, because we know that wildlife plays kind of complex roles in a lot of these contexts and has different uses and meanings and values for different groups. So to talk a little bit about patterns and similarities and differences across the countries, they were all very different contexts in which wildlife played quite different roles to different groups. So in China, it could be consumed as a little bit of a prestige good with certain more affluent groups, purchasing wild specimens commercially for consumption. And a lot of those as well were kind of bred in captivity. So it was the value of having that particular species, but they weren't necessarily coming directly from the wild. But of course, in February 2020, a lot of things changed in China, and there was a ban on that kind of consumption of terrestrial wildlife. But wildlife is still used and traded for other uses, just not necessarily for consumption. In the DRC, it looks quite different. Consumption is a little bit more normal and widespread, and you have folks who might be lower income or living in rural communities who would depend on that as a source of protein in some contexts or as a source of income, kind of selling depending on the different species and the markets that there are for different products of that trade. There's endangered species there where hunting and trade is illegal, but it still continues, and I think on the ground convictions are relatively rare, even if there's law in the books to prevent the hunting of certain species. In the Philippines, the use of wildlife is really not widespread, and it's restricted to certain indigenous communities. There's also Chinese cultural communities in the Philippines that would consume some of these products, and some of the indigenous Filipino communities have been relying on this as a source of food for generations, but there's also a growing commercial wildlife trade, including international kind of wildlife trade, contributing to growth and what's happening. So it's kind of important to think about those specific contexts, to understand when you put in place a policy, it's going to look really different across those different contexts. So yeah, we focused on some different policies that I'll keep short because I know time, but looking in the different contexts. So in the Philippines, we looked at kind of international conservation agenda setting and how that could kind of have an impact on the ground. In China, we looked at, now repealed, but previously government support and funding to actually develop the wildlife farming industry to try and reduce the kind of use of wild populations. And in the DRC, the kind of establishment of protected territories and national parks and how that could have an impact kind of on the ground. So in all of these cases, a kind of similarity was that this was an economic resources for different stakeholders, whether that was local community or, if you're thinking more at the habitat level for like a multinational mining or logging company. So these very different actors that were extracting economic gain from the use of these resources or populations, and that they would often kind of adapt or try and circumvent to protect in a way that economic gain in response to some of these policies. So just thinking about that context specificity being really important and what can happen when you don't think about all these different outcomes and how they might be connected. So yeah, definitely happy to keep speaking about it, but that's a bit of a summary.
Thank you so much. This is also quite interesting, and I love how you built on also what Arlette was saying. So it meant that if different countries are to tackle the issue of wildlife trade, there is no one size fits all. So, in the pandemic negotiations, when we talk about the need for such measures, there is a fear of these kinds of one size fits all policies. But the process that you described was also linked to involving the communities, working with different stakeholders who are at the front line of that issue, and developing completely different policy recommendations or ways forward.
Yeah, absolutely. I think, you have, it's really complex global laws, I'm sure this audience knows, and how to contextualize even things that are put in place globally and who to involve in that process. And there's so many stages to it and places where you can bring in context and allow openness to make things context appropriate. That, yeah, it's definitely that interplay.
Context appropriate. I think the member states will love that. So now turning to you, Benjamin. PRESOD is an initiative made of 240 members, more than 77 countries, and is focused on understanding the risk of zoonotic infectious disease emergence and developing and implementing innovative methods to improve prevention, early detection, and resilience. And I imagine that many of the members that you're working with are in developing countries. Would you be able to share examples on the types of efforts they are taking for prevention?
Yeah, definitely. Thank you so much, Nina. And so I think I will continue on what Chloe just said about the importance of this, the specificity of each context. So now PRESOD is a huge network, as Nina said, 240 institutions through the world, and also the support of 26 governments. And so what we're trying to develop also is to have a bunch of case studies or success stories showing that this kind of prevention, One Health prevention strategy can actually work really on the field. And so just to illustrate a little bit what we're doing within PRESOD, so I will just go through very quickly 3 examples which represent also the diversity of context we are facing. For instance, we are going to start a project in Thailand, which is really focusing on the concept of interfaces, because we have a lot of different kind of interfaces. Of course, we have interfaces between wildlife, between different species in wildlife through different transmission routes. We have different interfaces also between wildlife and livestock, but of course we have interfaces between countries, right? And of course, diseases do not know borders. And so what we're trying to develop in Thailand is really to try to understand how reforestation by communities can actually try to reduce actually this risk of zoonotic disease emergence, and especially focusing on rodent-borne diseases, which is generally a group of disease which doesn't receive enough attention, I think, regarding their potential. So the second example is something very different. It's in Guinea, and it's really about One Health surveillance. So Guinea has known during these last years several Ebola outbreaks. And of course, you can imagine when you may have Ebola outbreaks in your country, so surveillance is definitely crucial. And so since now several years, there is a strong One Health surveillance network in Guinea, relying really on the engagement of all local communities, all local actors, in order to be able to identify the weak signals as soon as possible in order to mitigate this kind of emergencies. But also, it's also important to combine that with the increase of surveillance capacities. And this is what has been done in Guinea with the increase of genomic analysis capacities. And so, for instance, in 2014, when an Ebola outbreak struck Guinea, the country needed about 2 weeks to confirm the first case of Ebola. And so you can imagine that in this kind of context, time does matter. And so the last outbreak at the beginning of 2020, if I remember well, was so all the genomic analysis capacity have been increased. And so the first case of Ebola has been confirmed in less than 2 days. So you can imagine that when you have this gain of time, of course, in this kind of context is crucial. And so the last point is what we are doing actually in Mexico, in the peninsula of Yucatan, which is one of the most deforested areas in the world, in Mexico, but also in the world. And of course, this is a tropical area with a lot of hazards in terms of zoonoses. And so what we're trying to develop in Yucatan is really how to develop this kind of win-win strategies between biodiversity protection and so the reduction of human exposure to zoonotic infections. But it's not just about biodiversity protection, it's also about education in sometimes very remote rural communities. So we are working closely also with NGOs, with all the different actors in order to try to set together a real integrative prevention strategies in this peninsula. So just to elaborate a little bit more on this last case, so the case of Yucatan I think is quite interesting because sitting here in Geneva, so the peninsula of Yucatan could seem very, very far, and it is, I can confess. But the point is, so the peninsula of Yucatan is connected with Mexico City with 10 flights a day, and Mexico City is 25 million people. So you can imagine that when you have a pathogen jumping from Yucatan to Mexico City, it's almost already in Geneva. So really, this idea to have local impact and to try to connect this local impact together in order to have really a global outcome in terms of prevention, I think is one of the crucial points we have to deal with. And this is a little bit what we're trying to do with PRESENT.
Thank you so much. This is incredible. So going through the different examples, I'm hearing the need to involve communities, the need for building scientific capacity, genomic capacity for communities to be able to identify the risks soon enough and report them, as well as impact starting in the community. We prevent a pandemic in the community, so it's definitely not to be underestimated. And on that note, I wanted to mention that in the pandemic agreement draft legal text that has not been finalized, the One Health section where they talk about the importance of involving communities is still in brackets. It's not yet agreed. So a lot of it has been agreed, but whether to involve communities in the One Health approach, still not marked yellow. So hearing you, that gives us good reinforcement for advocacy efforts. And listening to you also, I would like to open the floor for questions, but first, I just wanted to bring everything that you all said together. So we cannot see these animal health risks in isolation. wildlife surveillance needs to be integrated into public health policies. We cannot develop strategies in silos. The strategies need to be context-specific, and involving communities leads to them protecting themselves, but also protecting everybody else. And this is equity. This is how One Health helps achieve equity, by enabling communities to have the capacities and the skills they need to protect themselves. So I'll open the floor for a first round of questions before having discussions with, yes, I see a couple of interested people, somebody first in the front and then in the back, and we can take 2 questions at once and then respond, and I'll have a look at the chat for our online audience.
Hi, good morning. Thank you so much to all of the esteemed speakers for talking about One Health and pandemic prevention. I'm Winston. I'm here with the delegation from the International Federation of Medical Students Association. So it's a really important topic. So thank you so much for all of the discussions. I wanted to ask, given what you have all discussed about the heterogeneity of needs and context that we can see across all of these Global South communities and their relationships with One Health and recognition of One Health into their health policies, I was interested to hear from all the speakers on how a united front can be presented in terms of pandemic control, spillover prevention, and global health security. For example, as being aimed for in the pandemic accord, but as discussed, One Health's inclusion is still relatively contentious, while still recognizing different countries' unique contexts and autonomy in building these One Health policies. So for example, as mentioned, without this one-size-fits-all approach, and maybe perhaps as a secondary kind of addition, how youth can be involved in this process, for example, in advocating for One Health's recognition in our communities. Thank you.
Thank you so much. And we'll take the second question as well, and then I'll ask our speakers to jump in.
Thank you. I'm Gaurav Garg, Associate Director, Global Public Health with IQVIA. So, well, first of all, thank you to the panelists. My question really, when I was looking at the title, really in terms of the innovation, right, and in Global South. So I'm quite curious to maybe know a bit more about what role is the private sector playing in innovation, because sometimes I also feel like there's a misconception or perception that, you know, the role of the private sector in the Global South is maybe minimal, but when you look at healthcare access, a lot of healthcare access systems, tools, and technologies are being, if not driven by, but then coming via public-private partnerships under the ownership of the government. So I'm quite keen to hear about what sort of, when we were talking about wildlife disease surveillance, integration into public health, are you also seeing any tools, technology, solutions, ideas coming up through the private sector, which are not pilots, but are really scalable and sustainable? So, sorry, long question, but just to leave it out there. Thank you.
Thank you so much. So for the first question on differences between countries, we can't have a one-size-fits-all. How do we manage that, and what would be the role of youth? I was wondering if Arlette and Chloe, you'd like to take that one first, and then I'll hand over to Benjamin for the private sector question. Yes. So the question from the gentleman from the medical students was, different countries have different situations, so we cannot have a one-size-fits-all. How do we tackle that? How do we put that on the international agenda on the one hand? So do we go for general requirements on the international level and then specific on the national? And the role of youth, because I feel like you also engaged with different community stakeholders, and whether you encountered youth involvement.
I think that health is global. So there is some agreement at the global level, and also at the regional level and at the national level. And each of different parts should make it possible to prevent health of population. And Côte d'Ivoire is part of the global health security agenda. So in that agenda, we have also to really work on One Health and integrate wildlife sector as well as the domestic animal health and so on. So regarding that, the country is working to really consider all the aspect of One Health to deal all the aspect of One Health in prevention of public health. We are preparing the next security plan, national security plan, and in that plan, it's clearly given a great place to the One Health sector, because what we want, we have a kind of advance from the human sector, so we need to push the other sectors in the public health. So now we try to really integrate the wildlife in the prevention of health. Thank you.
So it means there is. So it's context specific, and in the case of Côte d'Ivoire, there was a detail level of strategy development on the national level, but then they were feeding that into the global health security agenda on what they considered to be important, right? And yeah, making sure to involve the sectors. Great, thank you, Alette. And Chloe, would you like to add on that point also on youth involvement? I'm guessing you might have spoken to some stakeholders.
Yeah, I could speak a tiny bit to both. I mean, I think building on like the part around contextualizing global law, I think it's so challenging, and there's just such a high risk of having, I suppose, unintended consequences when you implement something at the global level, and then what that actually looks like on the ground can be really different if you assume, you know, for example, a level of capacity or infrastructure or norms or just ways that things work in different contexts that actually aren't the reality. So I think probably tying into a little bit what you were saying, a lot of it I think comes from process and making sure you have good representation and inclusion and how you go through that process, and making sure there's, you know, windows of opportunity for people coming from different contexts to say, like, I can tell you that won't work in my country because X, and we need to frame it differently, or we need to, you know, frame it around aims, but have openness as to how to get there, or kind of different ways of approaching it. And I think for every issue, it will look really different how to do that, but I feel like a through thread would be that process and having inclusivity and representation, you know, people raising ways in which something global might not work in their context and how to design it so that it will be better. From the perspective of youth, we did have our colleagues in China particularly actually spoke to a lot of medical students and kind of younger folks. So I don't want to speak too much to their part of the work, but I know that they found certainly a lot of openness to the One Health idea, like people were either already aware of it, or they just said, like, yeah, absolutely, that makes a ton of sense. They were quite on board with the kind of agenda, and the intersection between human, animal, and environmental health really resonated with them. And if you think of that younger generation growing up in the climate crisis, I think it seems like a normal idea to them. So I think they're definitely, you know, great people to get on board in all different parts of this work as, you know, current students, members of future different workforces. So yeah, just briefly to that, I know they would be able to talk more to it, but yeah, thanks.
Yeah, that's also a good keyword. The current youth are students and the future workforce, and there is a lot of potential for building a One Health workforce, learning from each other, having those kinds of mixed disciplines. And on what you mentioned, so, and also to try to sum it up, so no one size fits all. If on the international level we set common outcomes, like Chloe's research was showing, wildlife trade, making sure wildlife trade is no longer a zoonotic disease risk, different countries achieve that outcome in different ways. So it would be important to leave that space for them. And Benjamin, if you want to add on that point, and I'll just mention again the other question. It was related to innovation and the role of the private sector, and whether there are any tools that the private sector has been placing, something that could be scalable, that could help with pandemic prevention through One Health.
Yes, thanks, Nina. And indeed, I wanted to tell you that I wanted to continue a bit with this discussion. No, just to highlight that also this diversity of context also highlights how important it is, how the approach actually is important, right? Because during a very long time, we had some kind of very kind of top-down approach on this kind of concerns. And so now, regarding the diversity of context, of course, we have to go through a bottom-up approach and really to try to co-design these different kind of strategies and policy with all the local actors. Otherwise, it's something that is not going to be sustainable, and so this kind of prevention strategy has to be sustainable, of course. And also, I think also the interesting point is actually all the local contexts have a lot to learn to higher level, if I can say, at international scale, and so on and so forth. And this is when we try to gather all the different approach strategies from all the different contexts, that we can see some commonalities and of course some differences that can help to shape so the most efficient policies, if you can say, at all the different levels. I think it's important to put some kind of competition between local, national, and international levels. Every level are important, but each of them have their own role actually, and so that's very. And sometimes it's not that clear what is the responsibility of which level, but I think that's another debate. Yeah, so for the second question about the implication of private sector, yeah, indeed, I do agree that it's something very important, and it's something which is very often underestimated. After, when we talk about innovations, it can means a lot of things, and so for instance, in terms of surveillance, we have a lot of things in terms of social innovation, how to engage communities on a long term. Also, how to develop community knowledge, how to develop all the different networks in order to improve the surveillance system. And that's just talking about surveillance. And I do agree also that there are a lot of technological innovations that are definitely needed. Every time I'm using the same example, but it's something I still don't understand why it's not more developed. But it's all these things about non-invasive sampling. And so for zoonosis, it's crucial, I think, because when we want to monitor what's going on in humans, so humans can go to the doctor or to a nurse to take a blood sample, it's much more complicated for bats and monkeys, for instance. So it means that catching wild animals, taking blood, releasing them without any kind of damage also, because that could be also another huge issue. It's something super complicated. And now in academia, there are a lot of methodologies to do this kind of non-invasive sampling with feces, with Hematophagous flies. So we have a lot of things, but they never really came out of the academia. And there is no private, no appropriation by the private sector in order to make it much more available. And it could be really, I think, a game-changing solutions in terms of One Health surveillance, and especially for wildlife, which is still kind of a black box.
Thank you for that, Benjamin. We have 5 more minutes potentially. If there's one more question, I see 2 questions, 3 questions. We will have a second round as well. Okay, so maybe the 2 questions here, and then in the second round, I promise we'll come to Catherine as the first one.
My name is Lasia Chena from East Carolina University. I have a question about how has One Health accounted for the implications of climate change on its effectiveness, especially with the loss of habitats and shifts in disease patterns?
Yes, thanks so much. Pedro Villarreal from the German Institute for International Security Affairs. So picking up on Nina Jamal's comment of this balancing the need to contextualize solutions, One Health solutions on the one hand, and on the other hand to agree upon a common set of goals and understandings that what it is that we need to do. In your view, and also related to Benjamin Roche's last comment. So considering the current state of art in the knowledge about One Health, and of course, keeping in mind this is an ongoing task that we still need to understand more about the different contexts, how much remains to be done? Do you think that at this point we could at least agree upon common frameworks with what we know, or do we need further research before we develop those frameworks broadly understood? And because as we see, there is much pressure to conclude this pandemic agreement and other legal instruments that would indeed entrench One Health and a set of obligations. So what remains to be done? What will be the priorities in your view? Thank you.
And just a clarification, what remains to be done so to make sure that there's a common understanding of the desired outcomes, or in the treaty?
Yes, in terms also of knowledge exchange, right, between the different countries, that we need to understand the context more deeply, and Chloe Clifford was also alluding to this fact. So how much more do we need to understand in terms of the context to develop common solutions? Thank you.
Okay, thank you so much. So the first question is related to the link between climate and One Health. Any takers? Okay, Benjamin.
Yeah, no, quite quickly, but I think it's an important issue, moreover, because now we can clearly see a decrease in terms of the momentum regarding zoonosis, pandemic, and so on and so forth. And we can see, of course, that the climate change momentum is still here. But so the interesting point with this kind of thing is it's two very intricate problems, actually. So that's just two manifestations of the same issue, which is, roughly speaking, way more to human activities on our ecosystem, to say it very, very quickly. It's much more complicated than that. But so pandemics, emergence, climate change, biodiversity loss, that's all actually a different manifestation of the same issue. So it's good also to try to connect these different kind of things. The point is, so climate change is something, slow is probably not the best word, but slower than pandemics. Pandemics is something super explosive, and so it changed our life from one day to another one. Climate change is very, very gradual. And so the idea, I think, is also to try to develop this kind of prevention strategies, and also to show, to highlight, to characterize what could be the co-benefits actually for other big challenges like climate change, biodiversity loss, and so on and so forth. So the idea is really to not try to put some kind of competition actually between the priorities, but just highlighting also how linked they are. And so what could be, and so the narrative is quite easy actually to have, it's really tackling the drivers to not solve all the problem, but to solve major issues. So, we do think that now, so I think this kind of momentum is changing, and so to try to have some kind of more holistic approach. But I think so one key point, as I said, with the success story is really to try to highlight so the benefits that we can have to develop this kind of win-win strategies.
Yeah, just to chime in to say I would definitely agree. I think climate change in a way makes a really good case for a One Health approach. Like, it has really real health repercussions for ecosystems, for animal and human populations. I think you're always looking in a kind of dynamic, evolving system, and with climate change, it's evolving maybe more rapidly. You have extreme climate events that create kind of like new ecosystems that have different repercussions for disease. So it's a challenging kind of environment to work, but I think the agendas, I would say, are really joined, and I like the co-benefits word of trying to think about how can we intervene in a way that serves these different agendas kind of jointly. So I wouldn't see them as in contest, but I think it's a good approach to try and tackle climate change, try and get different sectors on board with the climate change agenda as well, I think is kind of what part of the work that the One Health approach does.
Thank you, Chloe. So basically, climate change is a complex challenge, pandemics as well, and One Health is the approach, is the how. And if we build the how to tackle pandemics, we might even tackle climate change, which is quite exciting. And now to the next question that Dr. Villarreal mentioned. So how much remains to be done to develop a common framework? Is it already there? You've been working with communities, you've been working as experts. You've seen what we have so far. Is it enough? Is there enough out there to be able to tell the member states, it's here, we know how to do it, let us help you agree and advance the pandemic agreement on One Health and prevention?
Sure, I'll start. So that's a very good question, and that's a question that you should never ask to researchers, because of course he is going to say that it's never enough. Of course, but that's also interesting because it shows the kind of dialogue that we can have between science, society, and policies. Because so as researchers, our job is to produce knowledge actually, and of course, but I think the COVID-19 has changed a lot of things to this extent, and so now there are a lot of researchers that are trying to make their research actionable, and so in a lot of contexts actually, I think we do have enough knowledge in order to start being actionable, in order to start operationalizing this kind of research. But so the point also that policymakers have to understand is it's never going to end. I mean, we will always have something to learn from our system studies. So that's of course there is a question about dialogue. Talking about the same language, which is not that easy actually. So in terms of so the knowledge we have in many contexts. We do have enough knowledge to start doing concrete things and to start preventing. Will it be 100% efficient? Probably not, but it's going to improve through time. And see, if we wait to be 100% sure that it's going to work perfectly, we can end forever. So that's some kind of trade-off that we have to manage between all the different communities.
Thank you so much, Benjamin. So now I have some questions still for you, and I know the audience has some reflections. I've seen a couple of points as well in the chat. So I'll just ask you the first reflection questions based on what you were saying, and then we'll open the floor again to the audience. One of the elements that we were talking about was, so Benjamin, you mentioned Mexico, it's a mega diverse country, and one of the member states, not Mexico, one of the member states told us, they said, look, we are a mega diverse country. Do you want us to survey all the wild animals in our country? That's too much. We cannot do that. What can we tell them? What would you tell them?
Yeah, so Mexico may have told that, but probably not. No, that's a very good question. And I think this is where also research could be crucial to really guide also this kind of efforts. Of course, if we are working in mega diverse environment, it's not just possible to monitor everything against any kind of viruses or bacteria, any kind of wild animal species. So what, for instance, so you were talking about Mexico, Nina. So what we're developing in Mexico is really to try to understand what are the drivers that are shaping the different viral circulation in different animal species in order to identify what kind of animal species we should monitor first in order to have, and this is also it's very important to have these kind of things inside governmental authorities, because generally wildlife surveillance is mostly based on academic projects just for research purposes. And so that's not the same kind of thing to integrate this kind of data in governmental agencies, in health authorities and so on and so forth. So research can help, I think, to identify what kind of animal species should be monitored, where, when, in order to identify these weak signals that could, trigger some alarm somewhere to say, well, something is going to happen. So we have to go deeper in terms of surveillance, and so to explore more, and so on and so forth. Like what we do actually with outbreak investigation, but really at some kind of upstream, kind of pre-outbreak, if I can say, investigation. And so really to try to identify what kind of priorities should be identified, what in terms of animal species, and in terms of viruses and places and locations. I think that could be a good idea to develop everywhere in the world, but of course, as I said, it's really depending on the local context, because megadiverse can mean a lot of things. And so the megadiversity of Mexico is not the same one in Brazil, in Thailand. So this is where I think so this kind of dialogue also between research and health authorities and also NGOs who are working a lot on the field could be crucial to help shaping efficient and sustainable One Health surveillance system.
Thank you, Benjamin. So basically, we'll start first with the priority setting. So where are the risks? And then based on that, determine the priorities. And I'll let you have expertise in wildlife surveillance. So what happens next? We identify the risks, and then what happens next?
What I want to add is surveillance. It depends of every country has not at the same level of the surveillance system or One Health approach implementation. So, you know, surveillance is something heavy and costly, and any country can have the pretension to do easily surveillance of wildlife. But I think that we need to maybe identify key interfaces, because it's really at the interfaces that the spillover can happen. So we can also start by the interfaces identify according to the context of the countries, and then maybe analyze the risk to really have the spillover of any pathogen. I agree with my colleague that we need to also identify the key pathogens, because according to the context, we have priority. We need to prioritize the pathogens, and I think we can start by that. And the next step will be to analyze the risk. Based on that, we can propose the solution for prevention, and also involve all the stakeholders who really can impact the prevention or the disease spreads. Thank you.
Thank you, Arlette. I found that very useful, to see the common elements in both your assessments, that looking at it from a meta level, from a pre-zooed several countries and a specific country perspective, set the priorities, determine the risks, and focus. We're not telling them survey all the animals in your country. That's good. So Chloe, I wanted to ask you about something else that we've been hearing by member states. So some doubt about One Health is it's not only the mandate of the WHO. Say, well, it's also the mandate of WOA, the World Organization for Animal Health, UNEP, FAO. Why should we tackle it in the pandemic instrument? Why don't we just give parts of it to WOA, give parts of it to UNEP, give parts of it to the FAO, make sure each of them does their job, and also on the national level, why don't we just leave them in their boxes?
Yeah, I mean, I think both at the national and global level, there's so much to be gained from intersectoral collaboration and so much loss when there's really siloed ways of working. Like talking about surveillance, for example, there's so much potential additional knowledge, so much sharing of good practice that you can get through an integrated surveillance system, for example, compared to a siloed one. And I know a lot of countries are struggling with implementing something like that. Like they historically have had things quite siloed and are now trying to bring them together. And I think, you know, there's challenges for sure in learning to work that way when there's an institutional history and a tendency to work in silos. But I think you can, learn from each other, consider, I guess a key finding in our project was thinking about all the different outcomes that really matter and how if a conservation authority is intervening for one reason or a public health authority is intervening for one reason, they might not think about all of these kind of shared agendas and what their colleagues across government or across the UN might kind of care about. So I think coming together and thinking about trade-offs and co-benefits is really important, and to do that you can't work in that kind of siloed way. So yeah, I would say it's really crucial.
Okay, so basically they're not only pooling resources, doing things jointly, let's say a joint surveillance system, but the mindset changes because the outcomes at their disposal are much, they have much more options of ways to solve a problem and can get the others on board to help them with it.
Yeah, absolutely. And even talking about options like different ways of doing things, different policy tools that they have a history of implementing, or different instruments that they might have benefits in other sectors. And you wouldn't know that if you weren't working quite closely collaboratively. You'd kind of do things in the way that you've traditionally done them often, and you wouldn't get that cross-pollination, I guess, that I think can be very innovative.
Yeah, that's great. That's really, really helpful to see. So I think so there was one more question I wanted to circle back to, which is the role of involving communities. How would you convince diplomats to involve communities in implementing the One Health approach? Like, why would you tell them, this is why you have to have communities in this article on One Health?
Okay, I will be the first one to try. Well, I think one of the key thing is so the demonstration that kind of top-down approach is not working regarding the new kind of threats that we are facing. And to be honest, there are a lot of cases where this kind of top-down approach didn't work. If you heard what, for instance, the WHO was saying at the beginning of the 90s against malaria, it was just we have to kill all the mosquitoes, which sounds like a good idea, but that's it's I mean, concretely it's quite complicated to do. A lot of people have tried, but it's quite complicated. And so I think it's if we try to have a bit of distance and a good overview about what has worked and what didn't work, we can see that this kind of top-down approach now is definitely not matching what we are seeing. We are not in this world where there are still big killers like malaria, TB, HIV, and so on and so forth. But we have a lot of, so the word is not perfect, but small killers, but emerging a lot of time through the world. And so with the connectivity that we have today, it means an outbreak somewhere, even quite remote, can be a pandemic very, very quickly. So it means that this kind of vertical approach is not working anymore. And so we really have to understand what's going on in each country, because this is what I said with the example of Yucatan, but of course we can talk about COVID-19 with just a couple of cases at the end of December 2019, and the world was in lockdown just 4 months later. So that's just an illustration about how quick and violent these kind of things can be. So it's really, it's not like we have something like a super organization that can control all these big killers. Is that we really have to change our mind because the threats actually have changed. So it's not like 20, 50 years ago. So now we have a lot of small threats emerging all the time. And so it means that we have to change our approach.
Let me give you a practical example to the role to engage community. If I imagine that I have a great surveillance system of wildlife and public health system in Côte d'Ivoire, and we have a good reporting system to say if we have an animal in the forest or in the bush, we need to a died animal, for instance, we need to inform the veterinary service come to inspect, and then the information goes where and we take measures to solve the issue. I imagine this scenario to prevent disease from wild animal. Community has as habit to eat wild animals, and we made a survey in the community, and we noted that more than 30% of the community has already met a dead animal, and the first thing that they do is to take the dead animal and go home and eat this animal. So if the community is not really engaged about the risk to do this practice, even if you have a strong system in place, that can fail because the community is not really is not involved in that. So, thank you.
That's an incredible example. I think that would be very convincing. And also, thank you, Benjamin, for, yes, the top-down approach is not working anymore. I just have one more question to you all before opening the floor again to the audience for reflections. And I would like to start with you, Arlette. So you've done this incredible research, and there's a lot still to do in Côte d'Ivoire. If you had 2 minutes with your prime minister, and you had the opportunity to tell them what they should do next, so based on the research that you've done, what would you tell your prime minister is the next step?
Okay. In Côte d'Ivoire, we have a regulation on management of wild animals, and hunting and bushmeat consumption is totally banned. But this law is not respected because it's inadapted. We had so many publications which showed that it's not efficient for biodiversity, because if you go in any market in Côte d'Ivoire, you can see bushmeat which is selling. So it's not efficient in all species that you can imagine. And it's not efficient for biodiversity. And also for food security, it's not also efficient for food security because most of the wild meat come in town, and the local people, the indigenous people who really need this food for their nutrition and don't have access to that. And it's not also efficient for health, because there are many people who are involved in this activity. Bushmeat value is a value chain. There are many people who are depending on that for their livelihoods. So regarding all these aspects, this regulation doesn't work. So the only thing that I will require to the Prime Minister is to push the review of this regulation, because this review is ongoing since about 10 years. So we need to move on that. Thank you.
This is great. So revising the regulation and looking at all these different aspects that are not efficient, and how to make it more sensible as a whole system. Oh, amazing. Thank you, Arlette. And now, Chloe, to you, thinking of the 3 countries where you've done the research, so what would be the next step for decision makers like a prime minister or other leaders to consider?
Hello? Okay, no, it's good. Yeah, I think across, again, because we have this kind of comparative perspective and are thinking across these very different contexts, but I think a commonality is that, like, again, that process I was talking about of who's included in making different types of decisions. So communities were mentioned, the fact that communities have different norms and beliefs and, you know, economic activities and all different things and ways they interact with wildlife. You have lots of different sectors of government, you have, you know, private sector, lots of different actors who play a role in that, you know, the system where that law is going to unfold. And I think having kind of more inclusive decision-making processes that try and consider the different outcomes and consider the different perspectives is really important in this, you know, this kind of system where you have conservation outcomes, you have really serious population health outcomes for both people and animals, and you have, you know, economic, livelihood, cultural outcomes even where, you know, wildlife has cultural meanings for people. So I think having more kind of inclusion, and that is quite challenging to put in place in and of itself. There's, you know, different levels of power between all of those actors, even between the kind of One Health governance sectors, there's different levels of power and kind of jostling a little bit for that. So I think it's challenging to do, but I think that is the way forward. So it's maybe thinking about how do you do that in an effective way where you can still make decisions effectively, but more inclusively and considering this kind of range of outcomes that matter in these contexts.
So effective integration of stakeholders and considering the outcomes that they're working towards and see how they work towards each other. That's great, thank you. Benjamin, what about you?
Yes, so I will try to not repeat the same thing. So I have came up with a kind of ideas. So I think one of the key points and one thing that we saw when we tried to co-design Prezod is also this kind of interministerial communication. In some countries, I have to say that I've been amazed to see that some One Health platform exists and really try to do this kind of coordination between all the different ministries. Because of course, when you talk about One Health, it's about human health, animal health, environmental health, financing as well, and a lot of different things. And in many countries, actually, we generally have one ministry which is more or less in charge of One Health, which is one way to do, probably not the most efficient one, because always trying to get, how can I say, more light, or, you know, that's a kind of bias, at least, in how we develop these kind of things. So, yeah, so trying to find a common framework to have this kind of interministerial communication. Also, I think, so the key point, so we talked a lot about local context, which is dramatically important, but it's also to also make this connection at an international scale, because of course this kind of disease do not know borders. And so it means that clear, transparent data exchange is crucial if we really want to make progress. It's not easy because there are some technical issues, there are a lot of legal issues, and also some ethic issues. So it's something which is very important, but really trying to connect all these different kind of things at international scale is, I think, is crucial. And generally also one thing is in many countries, of course that's not the case of the countries I've talked about, but in some countries, so One Health strategy is seen as something that, you know, not could be fun, but could be interesting to try and to see if it works. Meaning that there is no clear kind of objectives where we want to go, how, with which funds, with support, and so yeah, in many countries this is sometimes what is missing. To really have a clear work plan, a clear roadmap about what needs to be done. How we can measure that and how we can support that. So, you know, we were some kind of amateur during a long time. Now it's time to get professional.
I love it. One Health can be fun. Yes. So there are a couple of questions I know. Maybe I'll take the questions and then I'll summarize and hand back over to our hosts. So I know that Catherine from the first round, you raised your hand.
Yeah, thank you very much. I'm just reflecting on what you say. I'm Catherine Urbais from the Health Diplomacy Alliance. if you allow me, I can reflect on a recent research I did on the implication of health diplomacy on One Health. So I don't, as a former diplomat, I don't see how you can implement One Health without having community involved. It's difficult to translate it in diplomatic words, but we do need to understand that all the resources are in the grassroots of what communities are doing. So we need to understand that once you involve community in the process making, especially for countries who already have systems and who have legislation, as we see in some countries, then you are able to go from bottom to top. And this is what I think is missing within the pandemic treaty. You might know what is being in terms of the negotiation. And I give you an example in the case of the case studies that I did. Rwanda, for example, is a country that had a framework and a steering committee on One Health since 2011 and has proven to use health diplomacy in order to use its aids and the collaboration with other countries and agency in order to stream down to their community in order to implement effective One Health policies. So I think we cannot talk about the global aspect of One Health without having in consideration what is the role of community. And I think this is something key in not only for countries to implement their national policy, but I think it is something that is key within the global arena at the moment. And yeah, I think this is a reflection that we all have to take in terms of the technicality of One Health and how politicians and policymakers and diplomats, they should implement what is happening at the global level. Yeah.
Thank you so much, Catherine. And towards the end of the session, there will be a QR code linking to a podcast that the team here did with Catherine about the case study comparing Rwanda and Switzerland. So that will be something to look out for. I see Nicoletta had her hand up in the middle. And then two people in the back.
Thank you. Thank you for this very interesting conversation. Many things could be said. I've picked up a couple of them. Well, Benjamin was wondering earlier on, which animal species we should monitor. And I think that the animal species that we should monitor is the human species. In the sense that you are talking about One Health, you have focused on wildlife and wild animals. Well, if there is one species which is wildly dangerous, is the human species. I'm a bit puzzled, I must confess. I am bringing some critical thinking, sorry, I'm a bit puzzled and also a bit concerned that we are tackling this topic in such a siloed way. That you're just concentrating. Now, the fault is of the wild animals. We have to go and track the feces of wild animals. Shouldn't we work on the fact that maybe even your president, your prime minister, has to face a lot of problems with land grabbing, with monoculture still imposed by a system of you having to repay the debt to your creditors, which force which type of economic system you have in your country. And this also has an impact on wild ecosystems and wildlife. So it is not the fault of the bushmeat, it is not the fault of the wild animals, it is the fact that your countries are subjected to a system of constant exploitation of nature, of environment, that exposes us to a One Health problem. So why are we talking about animals without really talking about the environment, the nature, I mean, the context in which these animals move? So I'm really a bit puzzled at this anthropocentric analysis, because COVID-19, of the many lessons that have been, explained in a very fruitful literary production of the lessons of COVID-19 that no one is actually following, is telling us that, we have to have a biocentric approach. The second comment I would like to make is related to the pandemic treaty, the negotiation, and the involvement of community. Benjamin, I very much support what you were saying earlier. When we talk about innovation, we should really look at social innovation, because communities know how to be, especially indigenous population, they know very well One Health. But in the pandemic treaty and in the political culture of the global health community, One Health is becoming yet another vertical type of disease intervention. And in this logic, which is perfectly reflected in the pandemic treaty, you may involve communities with a top-down approach, as we've done with the HIV, AIDS, malaria, TB, all parallel, where, of course, a storm of NGOs were created, civil society were all, top-downized to do the implementation work and reach out to the problems on the ground. So, yes, we can involve communities. Of course, we know that communities have the knowledge, they have the assets to give us also very important solutions, but they can be, and they risk being involved. They will remove the brackets at some point, but the approach will remain completely top-down. That's a risk that I seriously see. Finally, I'm saying that in the countries, especially in the global south, as animal farming is getting more and more regulated in the north, there is a shift of animal farming, industrialized animal farming, to middle-income countries like Ethiopia, just to mention one in Africa, India, or other unregulated countries. And therefore, you may have to consider in the future, not so much the poor wild animals, but the industrialized farming of animals, which is a vast problem that is coming to you precisely because you have to repay your debts, and that's the only way in which you can get some money to pay back to the creditors. Sorry, some provocative thoughts, but I don't think we are here only just to talk about technical projects around One Health. One Health is a political choice, not a technical solution issue. Thank you.
Thank you, Nicoletta. That it's good to hear that broader frame, and indeed we focused more on the technical aspects today. Benjamin, would you like to start? I would like to also add something.
Yeah, sure. No, I will try to be quick. So first, thanks for this fascinating question. So first, in terms of surveillance, I completely agree with you that when we try to develop prevention strategies, so the main objective actually is to tackle the driver, not to just monitor what kind of wild animal species should we monitor, to try to develop some kind of early warning system. I completely agree that the goal is really to do this kind of upstream prevention approach. So really to try, and this is what I said when we were talking about climate change, is really to focus on the drivers, on the factor, rather on the causes rather than the consequences. And so I think that's a little bit the idea of this kind of upstream prevention. The point, of course, is we know that it's not going to be 100% efficient. So we have to combine that with surveillance. But the fact that we are also developing One Health surveillance is giving an excuse in some way to not develop this kind of upstream approach. So this is kind of a trade-off which is not that easy. And also in terms of return on investment, I mean, it's going to be, and we know that, it's much more efficient to focus on the drivers, on the consequences, rather than monitoring the consequences and try to repair the mess after that. So I completely agree. Now, so the good trade-off, I think it's also different between different countries. But I think also if we want to go to the end of the story now, so meaning trying to really develop and implement this prevention approach and doing nothing else until we have reached this point, I'm a bit concerned that we're going to first miss the momentum, and that it can take decades, I think, to reach these objectives. But I completely agree. And also with what you say about the risk of creating over silos, I also completely agree. This is why I'm more trying to talk about prevention of zoonosis and pandemics rather than just One Health. One Health has become a very trendy word. which is good in some way, but at some point, so One Health is the approach, it's not the objective. You see what I mean? So, and we have to keep that in mind. And I do agree that, having an article on One Health per se, I think it could be an article on prevention through One Health approach. But, and so this is where the warning, and I'm not an expert on that. Nina is much better than me on these kind of things, and I will later talk about that. But and that's the same kind of for a lot of things like the bottom-up approach. At some point, we know that we have to do that, but at some point, it's become the objective rather than the approach. So we have to, at some point to get a bit of distance about what we are doing and say, well, are we going in the good direction? And how can we do things actually in a better way?
Yeah, and yes.
Thank you for your intervention. I just want to add the fact that if we are talking about wildlife surveillance, is because we have more interaction between humans, have many interaction now with wildlife. So for me, the idea is more to focus on interfaces that are the place or the organization where we have wildlife and human. So we have, for instance, the value chain. It's an interface. It's not direct the wildlife. We can have also, it depends of the context. We can have in our locality, we have sometimes lake or river where both animals, wild animals and human use the same water. You have also the kind of park where we have several monkeys and people come to play with with monkeys. So this kind of interfaces, it's the site or the place where the spillover can happen. So the idea is to find a way to survey these places, and also these the human or animals in these places.
Thank you, Arlette. There are 2 more questions and only a couple more minutes. We can have 5 minutes. Okay. Oh, you have a question as well. There are 2 people in the back, maybe very quick questions. So we collect the 3 questions and then we get 1-minute responses from the speakers.
My name is Polido Mutombo. I'm an academic in Australia, working on NTDs, global health securities, and I'm assisting some African countries and countries in the Pacific to implement the health emergency preparedness and response to the new fund from the World Bank Fund or something. But me, I work on the ground. One of the questions that come from the diplomat, when they say, how can you call the politicians? I think there is some things missed up from scientists like myself. How to talk to politicians. I think you have to create innovations, how to talk to politicians. Because if you go to see politicians, you have to put yourself in the skin of politicians. Politicians say, what is the value of money? But we are glad FAO just published now, if you invest $1 in One Health, or you can get FAO just published a study on it. But also a politician, they ask you questions. If I go in I want to be re-elected next time. If I go in my constituency, what can I bring? What can I talk about One Health? What do I gain from it? That's one of the things, how to talk to politicians. I think it was an issue, I think, to the Singapore One Congress 2 years ago. One of the questions is, how can we talk to politicians?
Yeah, that's a discipline in itself.
Because the way I'm talking to a scientist is totally different to talking to politicians.
Yeah.
And if you go to do the field work or anything, it's policymakers. If the policymakers that put his signature, you cannot do a field work, you cannot collect samples. But how can you talk to politicians?
Absolutely, thank you so much. So the economic case, and they get re-elected. That's very helpful, and we need to learn how to talk to politicians. Thank you so much.
Hello, my name is Riley Terzopoulos, and I'm a microbiologist and global health researcher with the Global Surgery umbrella. And my question is actually quite similar to the question right before mine, but how do we as researchers effectively communicate our research so that it has a shelf life beyond the end of a study date? And I think you mentioned one of the cases you mentioned is the regulation in Côte d'Ivoire about the bush meat, and there's research that says this is not helpful for our country, but that's still the policy. So how can we effectively communicate our research so that there's not that delay in action between research and study and action and implementation?
Thank you so much. And last question from Ellen, and then we close and hand over to Eric.
Well, thank you, Nina, and thank you all for this really enriching discussion. The gentleman, one before, he beat me to the punch, but once upon a time, I watched Richard Horton, the editor of The Lancet, ask a panel of very high-level global health policymakers a question, which he likes to use this. So you are in an elevator with the minister of this, this, and that, and you have between floor 1 and 7 to say something to convince them to invest in global health. What do you say? I said, he beat me to the punch. And nobody gave a compelling answer. It was so disappointing. Anyway, he was here yesterday in the next room moderating an event we had, and I asked him this question, and I said, okay, what's the answer? You asked the question, you must know it. And he said, if you want to get reelected, invest in global health, invest in One Health. That's it. It'll get you reelected.
That's a great one. And does anybody want to comment on how do we, I love that answer. That's a very good, concise answer. But anything to add on how can researchers better place their topics on the political agenda? Before we hand over to Eric, because Eric's time should have started 2 minutes ago.
Yeah, I guess something I think is we definitely have a gap from knowing doing. I think we all know that as researchers. And I think when speaking with policymakers, you have to have practical solutions. And I think you have to have looked at it from a lot of different angles. You can't just say this will work. You need to look, as you say, value for money, acceptability, even from the point of, the policy process. Is this something that can legally be put in place? Is it feasible? International comparators, countries that have experience with putting it in place, for example. I think there's all this broader array of evidence that's really important to decision makers, that as global health researchers, you might come with your epidemiologic study and have this will have an impact, but you don't have that really full picture. And I think that is quite important and a good case for, I guess, multidisciplinary work and coming together and saying from all these different angles, this makes sense, which I guess is part of the, re-elected kind of case that, it makes sense from a value for money, it makes sense from acceptability, feasibility, those kind of different angles on it, I would say.
Thank you so much. I would have liked to talk some more, but we're out of time, and I'll hand over to Eric.
Thank you very much for this debate. And you know that with the World Health Assembly Week, and I'm sure that you do a lot of meetings as this one, but you know also that a lot of this meeting is a communication meeting where all the things are just people giving their good picture. And but here I really think that we have a debate, and there is also in the World Health Assembly some place where there is debate. And what is important is to bring different angle in the debate, and also to bring the field in this discussion in Geneva, where there is so many diplomacy, useful diplomacy, but diplomacy. Thanks for all this discussion. I will take 4 words that I catch during your discussion. The first one is the research. So, of course, we are in a research institute. You are all of you researchers, so I really think that it's important. And what you say is that Benjamin say, don't ask a scientist, there is never enough research, and he's right, that we always need to learn, so we need to make research. But in the same time, you say that it's not because we need to learn that we cannot do things. We have enough evidence to be able to do things. My second word, it will be the question of the field. Alors, it can be field research, because it's good to have a bit more academic research, but it's very good to be really grassroots in the research, but also field experience, because we have already a lot of knowledge. The people who are on the field, they have a lot of knowledge, and we need to listen to them much better. And I am a medical guy, so I like the evidence-based medicine and these kind of things. But the field-based experience, the indigenous experience, maybe we need to be a bit more attentive. My third word, it will be bridge. Bridge as One Health in different scientific, in different field, is the first bridge, or breaking silo, but not only breaking silo, building bridge also. But it's also a bridge between science and policy. You explained several times about that. And you explain also science and community. Science and community join the question of field, but it's a field. And the last word, it's the how to do. It's time now to really build solutions step by step. There is no one miracle solution, but step by step we can do some progress. So I stop here. Thanks a lot for all this discussion, and I hope that you enjoy as I enjoy it. Thank you.